There's some exciting treatments that we have now for enlarged prostate that we can do potentially in the office. Rezum is a therapy where we use water vapor, and it's approved for use in the office. It's a scope that goes through the urethra. The procedure itself takes a few minutes. We do numb the patient because you have to be numbed, otherwise it would be uncomfortable for sure. But we usually use lidocaine, and we use some oral medication as well as nitrous gas. And the combination of those medicines usually makes the procedure comfortable for the patient. When we do the procedure, I'm injecting into the prostate wherever we see that it's obstructing the urethral channel. And each treatment takes about 9 seconds. Most prostates require anywhere from 4 to 8 treatments, so that's not too long before we're done with the therapy. Going into the procedure, there's a couple things that we need to know. I need to know exactly how big your prostate is, and that's usually done with an ultrasound, and that ultrasound is done transrectally. It's like getting a digital rectal exam. We usually also get a scope procedure, a flexible scope, done in the office to make sure we can get the Rezum device into the proper position. You know, as the water vapor goes through the tissue, initially there's going to be some swelling, and so the swelling, we take care of that by leaving a catheter in for a few days. Most patients, for example, on a Friday, if you have the procedure done, by Monday or Tuesday, we've removed the catheter. That whole swelling process can take up to 6 weeks for it to die down. During that initial 6 weeks, patients may have some worsening of their symptoms of urgency or frequency, but you're usually, you're able to go back to work, you're able to get back to your activities. 3 months, we have a follow-up, and patients typically at 3 months are much happier with their urinary symptoms. They've stopped their medications, their flow is better, their urgency is better. They tell me that they can, instead of waking 3-4 times at night, now they're only waking up once a night. The effect that you get with the Rezum therapy is actually better than medication alone. Urolift is another exciting procedure for enlarged prostate. The Urolift is a really clever device. The Urolift is, if you imagine a facelift, the Urolift is like a facelift for your prostate. We go in through the urethra, and the device then opens up the prostate. It's, if you imagine a tiny little suture like we would use anywhere else in your body, the suture has a little clip that holds it in place on the outside of your prostate, and then another little clip that holds it in place on the inside of the prostate. And so then the thickness of the donut is then squeezed, which causes the donut hole to get bigger and bigger. And so then guys have an improvement in their urinary symptom. Usually a Urolift we can do with 4 or 6 lift placements. Depending on the surgeon's experience, those placements could take a few minutes to do. Sometimes these treatments are available in the operating room under some light IV sedation, and sometimes we can do it in the office. So at the Urology Place, we've been following these technologies for a long time. We actually were one of the first sites to do both procedures. We've done Rezum over 5 years ago and Urolift as well in 2014. And we've done hundreds of patients with Rezum therapy, and we've done over 100 patients with Urolift. We offer the therapies in the office for Urolift as well as under IV sedation in the operating room. And again, if you are self-pay, both therapies are, in my opinion, are attainable because we can eliminate the costs associated with anesthesia and the surgery center when you are a candidate for Rezum or for Urolift.